Namaste to all, and cordial welcome to the 10th session of GURUKULA. Today we have Dr. Pavan Madan with us to talk on the topic clinical significance of Krimi Chikitsa. A cordial welcome on behalf of all of us to Pavan Madan sir. Pavan sir, welcome to GURUKULA sir.
Namaste,
So,
namaste to all. Good evening from India. So,
may I kindly introduce Pavan Madan sir before sir starts his presentation. Sir is specialized for more than 27 years of clinical practice. He has a global experience, specialized in treating many disorders, but has a special inclination towards lifestyle disorders and chronic disorders. He has a patient-friendly approach, and that makes him a great clinician. So that is very important. He is sir is having a holistic approach in diagnosis and treatment of any disease or any patient which comes to a stable, like comprehensive approach, what we can call it as. So, as he also conducts psycho counseling sessions to the patients, so that makes better understanding of the diseases. Sir Pavan sir works as senior Ayurveda consultant and technical lead manager in Punjab zone of Jiva Ayurveda Corporation, Faridabad. Today, sir will be speaking on the topic clinical significance of Krimi Chikitsa. Over to you, Pavan sir.
it is a great privilege and opportunity for me from Easy Ayurveda to present some of my views and some of my experience on this less known topic. So, the topic is Krimi Chikitsa. First of all, I would like to say some few words why I am talking on Krimi Chikitsa, because in today's time, we are fighting with many such diseases, which are generated due to autoimmunity in the body, and we have very less weapons to take care of these. So we will see today what can we do for these autoimmune disorders with this line of treatment, which is called as Krimi Chikitsa. I would elaborate what is Krimi and what is Krimi Chikitsa in the next few slides. In today's time, the practice of Ayurveda is being done in two ways. One, there are some practitioners which are doing Ayurveda treatment with the modern diagnosis, and there are few others which are doing Ayurveda treatments with Ayurveda diagnosis. Actually, both the systems, both the lines of making doing treatment are right, but if we want to get very good results, we generally, I would prefer to be on the Ayurveda diagnosis and Ayurveda treatment. So whenever a disease comes to case come to us, we would like to make an Ayurveda diagnosis for that particular case, and then will chalk out the Ayurveda treatment. And for doing the Ayurveda treatment, we have many options. Few of the options I am going to discuss. First of all, we can name that particular case as a specific disease, which is called as Vyadhi, and we have the particular treatment for that particular Vyadhi. Right? If we are not able to diagnose that case into a particular Vyadhi which has been explained in Ayurveda, then we make the diagnosis as per the pathology in the particular part of the body where the pathology is present. So that is called as Srotodushti. So this is a technical term. So this is also, we come to know where is the Srotodushti in the body, and then we employ the particular line of treatment for that particular Srotodushti. May it be a number of diseases included in that Srotas. Srotas means channel. And another way of doing the diagnosis is doing the diagnosis as per the disturbances in metabolism. Generally, this disturbance in metabolism is in the body, is in the tissues, but it can be on the level of intestines, it can be on the level of GIT, and both of these are called as Agni Dushti. Agni is the digestive capacity, digestive power of the body, which is named as Agni in Ayurveda. So we can diagnose certain kind of conditions as Agni Dushti. Then there are some other conditions which don't fall in the category of Vyadhi, Srotodushti and Agni Dushti, and then we diagnose those cases as Dosh Vaishamya. So Dosh, I hope everybody is well aware of this term, which is called as Dosh. So Dosh is some factors, entities, some may call it as energies, some may call it as factors in the body, which are needed for the normal physiological functioning of the body. And if the physiological functioning of those particular entities and factors disturb, then they can produce disease in the body. So in that way, there can be n number of entities in the body which are called as dosh, right? So some of the conditions are called as dosh vishamya. So some other cases which could not be diagnosed even in dosh vishamya, and there are some anatomical disturbances. Those categories of cases are diagnosed in the term dhatu vishamya. Dhatu means tissues of the body with which the body is formed. So there is another category which is called as mal vishamya. Mal vishamya is when there is a disturbance in the processes of evacuation, in the process of evacuation from any part of the body, whether it is like gross or subtle, right? So that is, those cases are called as malavashamya. So we can diagnose that particular case in any of these categories, and then we can employ the particular line of treatment, and we can give care and cure to the patient. Next, when we see all these categories through which we can diagnose that particular case in the form of Ayurveda diagnosis, but there are some cases in which we see, even if employing the normal Ayurvedic line of treatment, we are not able to provide the required therapeutic effect to the case. See, what are these cases? Let us say there is a case, there is a 21 years old boy which is having chronic allergic rhinitis with urticaria for many years. He has been diagnosed as a case of particular vyadhi, which is called as Jeern Pratishay or chronic allergic rhinitis. All the treatment opposite or suitable for that particular disease has been employed, but still the boy is not getting permanent relief, though he is getting the symptomatic relief for few days, but again the problem is coming again and again. He has taken many antihistaminics, many anti-allergic tablets, but still the problem is recurring again and again. Then how and what we can think of that? Does it need to think in such a case? Again, there is a case of 12-year-old boy with the bedwetting. You consider 12-year-old boy having the problem of bedwetting every day or every other day, and this is a very irritant thing for the boy as well as the family. The usual treatment, which is like psychotherapy or some mild sedatives or some digestives or some brain tonics, they are given for this problem, but still we see we are not getting the result even after doing the proper psycho counseling of the parents, of the family, but still we are not getting the results. Here we need to think something which is lateral thinking. We need to do why this is happening. So we will find out why. Take another case of 27 years of female having pain abdomen with various digestive upsets, and Ayurvedically she has been diagnosed as a case of Vataj Grahini. All the treatment of that Vataj Grahini, which is texted, which is mandatory, like Deepan, Pachan, Grahi, Anuloman, like specific digestive and carbonative treatments has been given, but the that female is not getting relief. She has to take PPIs and other modality improving drugs again and again. Then what? What to do? How to proceed? Again, a 47 years of male having psoriasis and eczema. So mixed picture of psoriasis and eczema, and he has been diagnosed as what we call as an Ayurveda. It is called as Kusht Rog, and we know what are the doshas in that. We know what is the rakt dushti in that case. We are employing all the rakt shodhak chikitsa. We are employing all the corrective chikitsa for correcting that dosh vaishamya or the disturbances in the doshas, but the the person is not getting relief. So what chikitsa siddhant line of treatment should be thought of in such a case? Another case, these are very important cases. Like, I have taken one case of SLE. So a case of SLE comes to us, systemic lupus erythematosus, and she is having lot of different symptoms. She is having skin problems, skin symptoms. She is having joint pains, arthritis is there. We are diagnosing that case according to all the rules of Ayurveda. We are treating the specific cause of that disease, which is called as arm. We'll see what is arm next in the next slide. We are doing all arm pachak specific treatments for arm. We are doing all dosh viparit chikitsa for that, but still the lady is getting bouts of symptoms again and again. So need to think alternative in such cases. Another such case, this is a very interesting case. This is a case of alopecia. So alopecia has been said as it's a very difficult problem. There are no significant and sure treatment for this. So we like that this young male, 24 years boy, has been taking the treatment of alopecia from many dermatologists. He has been given many anti-fungal shampoos, many other such medicines, but not getting relief. So how to make a diagnosis? So these are few of the cases in which this is a common problem. This is a problem for an Ayurveda physician as well as for a modern physician, and we need to do something which has not been done yet in the science. So what to do? Here comes the role of Ayurveda. When Ayurveda says we need to do something which is called as Hetu Viparita Chikitsa in such cases. Hetu is the reason, Hetu is the cause of the disease, Viparit means opposite. So when we will do the treatment of the cause of the disease in particular, then we may be able to provide relief to the patient. So here proper history taking is important. Investigations also sometimes helps to find out, because we all know we are using hundreds of types of investigations to find out what is the cause. But the question still remains the same. Are we able to find the cause? Or if we think that this is the cause of the disease, are we able to cure that disease by treating that cause? Yes, of course. In some cases, like in some infectious diseases, we are able to. But there are many other diseases which I have given the examples. We are not able to provide the required relief. So here, proper history taking is the key for unlocking the hetu of the disease. To find out the causes of the disease, we need to know the proper history taking. We need to take at least history from the last 20 years in that particular case. And from that history, we will come to know if we can find out the cause of that disease or not. So what we need to think in such cases, like in all these autoimmune and allergic disorders, what are the factors which we need to explore? That is called as Amadosh, Dushivish, and Krimi. These are the three important things. Though I have written all these things differently, but they are interconnected. Like Amdosh may produce Krimi, Krimi may produce Amdosh, Amdosh may produce Dushivish, Dushivish may produce Amdosh. So let us see what are these things. So I should not confuse all of you. So let us see. So Amdoshas. Simply, I have written the explanation of these two terms in simple lines, but there can be more explanation to these terms when we'll go in detail. But in general, we need to understand what is amdoshis. These are the intermediary unmetabolized products of digestion and metabolism. And these are the unmetabolized products at the level of GIT as well as at the level of tissue level, in the cells, in the tissues, and in the gut also. Although all those materials are called as amdosh, right? So any product which is like an unmetabolized product can be called as amdosh if that particular factors is exhibiting the properties of amdosh. Similarly, dushivish. Dushivish are some specific products or molecules or entities which could not be metabolized and evacuated from the body. Simple. So these are two similar things, but there can be some difference. Dushivish is something which is there in the body for years. Amvish is something which is there in the body from recent times. So when amdosh becomes chronic, and still not producing a disease, it is called as dushivish, right? So these are the two similar things. Next, we'll come to our topic that is called Krimi. So what is the meaning of Krimi? So you can see on this slide, this is some few references from some dictionaries of Ayurveda as well as from some text of Ayurveda. Though there are many references, but I have chosen only these three references to know what are actually Krimi. So Krimi are those organisms, in simple terms, that moves and walks is Krimi. That is the literal meaning of Krimi. Krimi's literal meaning is which means to step in or to walk. So what we will see again in the next slides, and in one Ayurvedic text which is called as Rasa Jalanidhi, in that text in chapter 12 is completely devoted to these Krimis, and those here we will find all the worms and the bacilli and other microorganisms will come under the broad. So these Krimi are micro or macroorganisms. On simple terms, these are micro or macroorganisms which can be seen with naked eye, or which can those even those cannot be seen with naked eye. In Ayurveda literature, many types of Krimi has been named and they are given different names. I'll not go in detail of that, but only we need to know that Krimis are those organisms, micro or macro, which can be seen or even they cannot be seen with the naked eye. Some may be seen with the microscope, even some may not be seen in the microscope, even in today's time of such a advancement. Right? Again, next we'll see that what are the causes of Krimi production or Krimi generation. There are many causes in the body which help the body, which gives a suitable medium in the body for the promotion or for the generation of Krimi. Few of them are called as a gene. A person which is having chronic indigestion problems may led to the formation of Krimi in the body. It's a process, a gene causing indigestion. Indigestion is producing amadosh. Amadosh is producing more of the clay. Now, clay is some technical term which can be explained in a good way. So that clay helps to help or gives a conducive environment for the generation of the worms. Similarly, there are few types of foods like which are very sweet foods, which are very heavy foods. Heavy foods means which are very difficult to digest, right? So intake of those foods continuously and in excess amounts lead to the generation of worms. Adhesion. Adhesion means we need to see when we are going to eat a meal, we need to see whether the food which we have taken before few hours back has been digested or not. And if we are taking food again and again, before checking this, before our previous food is not digested, that condition is called as adhesion, and this habit is also producing indigestion, then amadosh, then again the formation of Krimi. Asatamyam. Asatamyam means we need to know what type of person we are, and we need to know in what area, in what country, in what environment. It's called as a desh in Ayurveda terms. So in what environment we are living, and in that environment what type of foods we need to intake. So let us say a person who is living in, let us say in India, and he is accustomed to eat those kind of fruits which are not produced in India, and those fruits which are imported from outside countries, and he is taking those kind of foods daily in excess amounts. So that process is asatamyam, and that thing is going to help the body to produce worms. Another thing is virudhashan. Virudhashan means taking the opposite nature foods. See, there are many kind of things which should not be taken at one time. I will give an example of that is milk and salt. When one person is taking milk with anything which is salty, chronically, daily, on a daily basis, in large amounts, at a later stage, he is giving a suitable environment for the production of Krimi or the organisms or the micro or macroorganisms. So these are the few causes which I have listed, though there are many other causes. We can go in detail in some other presentation, but just to know that these are the causes which help to produce Krimi in the body. Let us know the symptoms of Krimi or Krimi Rog. Krimi Rog. So Rog means disease. Krimi means I have explained. Krimi means organisms. So the diseases produced by the or those organisms which are seen or unseen, which are called as Krimi. These are few of the general symptoms which are explained, which are written in this shilok. So this is just for the reference. We'll see in next slides what are those kind of symptoms which we find in our practice to know if the case in front of us, if the person in front of us is having the Krimi Roga or not. Symptoms of Krimi in practice, there are many symptoms which are produced by the Krimi, which we see in patients in general. There are some general symptoms, there are some specific symptoms. We need to see the more and the more symptoms. We need to see how many type of symptoms we are getting in that particular case. And we need to then infer from the history of the patient that this patient is having a lot of Krimi in his or her body or not. So, like jwar and discoloration on the body, and extreme loss of desire to eat, loose stools, although there are many other causes of these symptoms. But when these symptoms are combined with these symptoms, like teeth grinding, है ना? Somebody teeth grinding is called as, I think this is called as bruxism in some places. So teeth grinding is there, abdominal pain is there, itching on the body is there, urticarial type rashes is there. There are different names, there are different terms, kandu, coat, pidka, shavta. So we need to understand all these symptoms. We find all these symptoms. Let us say a person is having a discoloration of the body, like there could be many symptoms of this discoloration, or these blackish spots, or this hyperpigmentation. But when they are combined with itching on the body all over, and when they are combined with the history of teeth grinding, then we may decide on the lines of that this person may be having Krimi. As I'm saying, history taking in a complete sense is the most important thing which will lead us to decide that the person is having Krimi or not. I have done this in many cases, in hundreds and hundreds of cases. No worries, you can also do that. Similarly, these are some other general symptoms. This is increased salivation in the mouth, nausea feeling at any time of the day, seeing any type of food, or excessive sneezing or nasobronchial allergies. When these combined with those, like those specific symptoms, when you get many of these specific symptoms which are underlined and some of these general symptoms, then you may think of that this person is having the Krimi infestation. Similarly, here we feel these are the very specific symptoms. Bedwetting is a specific symptom of worm infestation. Itching at anus is a specific symptom of a particular type of worm. Feeling of borigami is a particular type of symptom of particular type of worm. Similarly, this is very important. Craving for some foods and extreme distaste for some other foods. Then you will take the history of the patient. You'll ask, did you have craving for any type of food ever in your life in the last 10 to 15 years? Please ask these questions. Please ask these questions. You will find patient will tell. Today also I got a disease of skin disease, like that was something, some disease was different, that was like a fungal infection, but that was not actually fungus. When I took the history of the last 30 years, then I came to know that that lady is right now 50 years old, and she is having this skin problem from last 4 years. And she told me that she was having a craving for eating rice, only uncooked rice, like in the form of like 100 grams, 50 grams daily. What she was doing, she was like putting the uncooked rice in water for some time, and then she was eating, and she was crazy for that, right? So this is a particular symptom of worm infestation, right? So when you'll take history, you'll come to know many such symptoms. Even though maybe I have not listed those symptoms in this presentation. Similarly, there are some other symptoms like abdominal distension, generalized body pain. Generalized body pain. We are actually very much confused when their patient is coming generalized body ache. We are going for all arthritic panel. We are going for all autoimmune tests. We are doing everything. We are doing every investigation, but we are not finding the cause of why a patient is having generalized body ache. Patient is like weeping. Patient is like saying, my body is aching. I'm not able to bear that. Painkillers are not working. So please do take the proper history. You'll find this pathology. Similarly, sneezing and chronic cold. When a person having these symptoms with actual history of sneezing, you'll ask that where you did you ever have some symptoms like sneezing, getting up from the bed, sneezing, going out in the air, sneezing when exposed to some heat or some cold, and patient will say, oh, yes, 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 patient is coming with the skin problem, patient is coming with eczema. When you'll ask, did you ever had a chronic cold? Yes. He will say, I was having chronic cold and sneezing like 10 years back, and it remained in my body for like 8 to 10 years. And as soon as this skin problem or eczema developed, that symptom of chronic cold and sneezing went off. So this kind of history you will get. So all these symptoms will lead you to think that this case may be a case of Krimi infestation, and you can give that patient a cure and help in a good way with Ayurveda. Another special symptoms of Krimi, though these special symptoms are found in the cases which are like complicated cases, which are like very chronic cases. This is the reference from Sushrut Samhita from Madhav Nidan. So we'll see there are few symptoms like feeling of what we call it as ginjini. So ginjini is a word which explains, which includes many different symptoms of neuropathy, like itching, like feeling of numbness, like feeling of coldness, like feeling of walking on the cotton, like feeling of walking on the stones. All these symptoms are of neuropathy, and it is described about gingiva, right? So in the later stages, when there is too much of worm infestation, there can be destruction of hair of head, birds, malaria, like I said, in the cases of alopecia, and the destruction of various tissues. There can be that, but this is an extreme condition. So we need to keep this in mind. So here we come to know that there is a class of diseases which can be given a cure. The patients of these diseases can be helped with this line of treatment, which is coming from Ayurveda, and Ayurveda's Krimi Chikitsa is going to help us all these conditions: nasobronchial allergies, urticaria and related disorders, most of the allergic skin disease, eczema, chronic dermatitis, psoriasis, and similar diseases, and many autoimmune diseases like SLE, scleroderma, multiple sclerosis. You need to take the history. Though I'm not saying that if a case is coming of scleroderma and with this Krimi Chikitsa, you can cure it this 100%. But if our diagnosis is perfect, if our understanding of pathogenesis of this Krimi is okay, and we are satisfied, even if we cannot cure 100% this kind of conditions, but we can improve the life of the patient. Like a patient of SLE is suffering from too many problems, like skin affections, like joint pains and many other things. So by applying these medicines, this line of treatment, you can at least help the patient to improve the life. Like various alopecias, all alopecias are not treatable with Krimi Chikitsa. This is clear. One case is alopecia universalis, not treatable with the Krimi Chikitsa. But there are some other types of alopecias which can be treated, and we have treated such cases of alopecia. Right? But we need to connect. We need to connect the symptomatology with the history, and then we need to check out the line of treatment. Similarly, many GIT disorders, we call it as Anadarashul, Parinamshul, and many such things. We call it as Grahani, many such cases. In the broad category of GI disorders, we can help the patients with this chikitsa. Bedwetting, sure. Bedwetting, the treatment of bedwetting with Krimi Chikitsa is 100% sure. You can take any patient of bedwetting, take the history. If you find those symptoms, you apply the Krimi Chikitsa for 3 months, you are sure to get the results, right? This is a small list of diseases which I have given. There can be more and more diseases which can be treated like this. So after that, I would like to say something about some useful Ayurvedic medications for Krimi Rog, but this is very clear. All these details are for the information purpose only. We need to employ the Krimi Chikitsa under the guidance of our Ayurveda physicians. This is very, very important. No medication is to be done by oneself, by yourself. Doctor or your Ayurveda physician must be informed, must be contacted for this. and every treatment should be done under the supervision of the Ayurveda physician. First is Krimi kuthara. This is a herbo mineral medicine. Though it has a its main component is palash, which is called as Butia monosperma, and it helps in many ways. It in many cases of nausea, giddiness, excessive salivation, like I have written the symptoms: itching on the body, itching at anus, heaviness in the abdomen, and this medicine need to be used judiciously as per the age, as per the case, as per the season. We need to use this medicine under the guidance of Ayurveda physician. Then we can help the patient to cure the problem. Yes, of course, it contains a special ingredient which is called as Vatsanab. So Vatsanab is something like a little bit of toxic component. But toxic component does not mean that it is going to produce toxicity every time. Everything we need to use judiciously. Even in modern medicine, the gold is used to treat rheumatoid arthritis. So we cannot think to use gold to take orally, but like gold is used to treat rheumatoid arthritis in modern medicine. Similarly, there are many things, Vatsanab like things, which can be used in Ayurveda medicines for treating many diseases, for getting fast results. So we should not need to worry. We need not to worry from these things. The only thing is that we need to use everything judiciously in required amount, in required patient, in required season. This is the conditions, terms and conditions which need to be taken care of. Similarly, another medicine is Krimi Mudagar Ras. So Krimi Mudagar Ras is also similar to Krimi Kuthara. There is a little difference as it does not have Vatsanav. So it is more like acceptable. I would not say safer, because Krimi Kuthar Ras is also safe. I am using this Krimi Kuthar Ras from years and years, for months and months on, for 2, 3, 4 months, and I'm not getting any bad effects. But like it is more like acceptable. So it does not contain Vatsanav. It can be used in even in kids. It can be used in those persons like which have very low digestive power. They are like old age people. So we need to use this medicine in such cases. In all the cases of creamy symptoms like indigestion, vomiting, fever, unconsciousness. Unconscious means like becoming unconscious for a small time, like a simple unconsciousness, right? So one symptom is repeated hiccups. Like this can also be treated with the Chikitsa of Krimi Chikitsa, with treatment with this. Right. So another medicine is Vidangadi Churan. This is in the form of powder. It contains simple medicines like Vidang, Sandhav Namak, Small Harad, Kabila, all equal, and Yavakshar 1/10 in from other great ingredients. So this formulation is taken from Chakradat. I have been using this formulation from many years. Not a problem. The only thing is that it can cause loose motion if given in large amounts. And when we need to give a good evacuation effect, like we call it as anuloman, with good deepan pachan, like good digestive action, good carminative action, as well as creamy har action, we use this Vidangadi Churan. This is used in very small amounts, and even in the doses of 500 milligram, it works very well. Similarly, there is another medicine, Vidangadi Loh. This is a combination of Vavidang and Loh Bhasam in Min. Loh Bhasam means this is a special kind of medicine prepared from the source of iron. This is called as Bhasma. So this is also used in small doses. Can be used in any type of persons, even in children. This is not causing any problem, and it also worked as a rasayan with the qualities of creamy her. It is having also the qualities of rasayan. It is supporting the tissues of the body. It is helping to grow the new tissues in the body. So it is something like which is good for the conditions of dhatu kshay and dorbalya. Dorbalya means when there is very much weakness, fatigue, or prostration. And it can also be used in some kind of anemias where worm infestation or creamy is with anemias. So this is a multi-purpose medicine, Vidangadi Loh. This Vidangasa is a medicine in the form of liquid, and it is formed in a special process. So it has many multiple actions like called Deepan, which increases our digestive fire. Pachan, it helps in digestion of the food we eat. It is Grahi, helps in the proper formation of stools. It is called as Antra Shodhak. It detoxifies the gut. So this is a very important medicine, when we, even if we can, if we use it alone, Vidangasa, in the required dose, like 20 to 30 ml with 100 ml of water twice a day for, let us say, 3 to 4 months, it detoxifies the gut in a simple manner. We say like that. So it is also acting as a creamy herb, like antimicrobial or kitanunashak. Again, this medicine is acting as a creamy herb medicine, as well as it, in the long run, it is acting as a rasayan medicine. Rasayan medicine means which is helping the tissues to grow in a healthy way, to form in a healthy way. So in the long run, it helps in the normal formation of various tissues, especially the blood formation. Last medicine which I use in a very good way, very quite often, which is called as Krimi Churan. This is taken from Bheshaj Ratnavali. It is containing simple herbs like harad, palash, kampilak, and some other herbs. This is a very gentle medicine which is called as Somme. Somme means gentle medicine. It is also having a good, mild, like laxative action. Actually, what the word laxative is not good, which we call it as anulomak action, means it helps the good evacuation of stools to the person. So if it is given with Am Pachak Churan is a specific powder which contains 5 different medicines. So which are like digestive and carminative. It is added with that. It gives wonderful results. Krimi Churan is given in all type of persons, whether any type of prakriti they are. That is all from my side. This was all I wanted to talk to you, and this is again, we, if we want to know more about this, then we can go through this book, When Your Autoimmunity and Allergy, which is my little try to tell what I am doing and collaborating my experience in that book. Thank you very much.
Thank you, Pawan sir, for elaborating the causative factors and the different perspectives of understanding Krimi, different conditions in which Krimi needs to be considered, and different treatment aspects, medicines, formulations. There is a concept where people understand or misunderstand, like Krimi concept is equal to bacteriology, like it can be compared to bacteria, virus, fungus, anti-helminthics, antifungals, and a lot more things. What is your take on that, having worked on Krimi such extensively? Is it wise to compare, or we will keep Krimi and Krimi concept different from that?
See, in general, if we look at all the references, if we look at the Ayurveda literature, Krimi means all the microorganisms or the macroorganisms which can be seen, which cannot be seen. So if we take this definition, then it, all the microorganisms like bacteria, viruses, fungus, helminths can be taken broadly in that category. But we are not taking all these organisms in that category for the sense of a difference, because Krimis are generally Krimis, we take generally Krimis like parasites, like those parasites which are seen or which are not seen, because all the symptoms which have been described and which I have listed in my presentation, they're all produced by parasites. So generally what I consider is we need to like keep a little difference from the bacteria, viruses, and the parasites. So parasites which may include fungus, parasites which may include many other things, they can be given the name as Krimi.
One more question added to that. Like at the beginning of your presentation, you gave an introduction, beautiful introduction. So like, can we apply Krimi Chikitsa in conditions where other medicines are not yielding good results? So can we think about Krimi in those conditions?
Yes, very much. I am emphasizing this from the beginning of my presentation, that we need to think laterally. We need to think all this Krimi in all the conditions of allergies and autoimmune disorders. Like,
is it wise to begin treatment for many conditions with the Krimi Chikitsa itself? Like Ayurveda has a theory of in most cases, because most diseases are considered to be having their origin from Agni. So Deepan, Pachana, Chikitsa, we start with those Chikitsas. So like, what is Pawan sir's concept here? Can we also begin with treating, because some of the formulations you mentioned, Vedanga Churna and other things, where Deepana, Pachana, Sramsana, all those actions are there along with Krimi Hara Chikitsa. Is it wise enough to start a Krimi Chikitsa in any chronic non-healing conditions? Number one. And if yes, what are the limitations?
Yes, we must give a thought to this seriously. The basic concepts of Srotodushti, Agni, Malveshame are there, they are present there. So let us say there is a case of eczema. Patient is having Agni Dushti. We are treating Agni with Deepan Pachan Dravyas, with Deepan Pachan medicines. We are treating these things from the last 3, 4, 5 months, and we are only getting results sometimes. Okay, not okay. And when just we are stopping the medicine, the condition is again recurring. In that case, we need to think that Agni Dushti, that Agni Vaishamya, what is the result of that Agni Vaishamya in a later stage? In the chronic period, like a person is having Agni Dushti, let us say from last 10 years. Do we need to think the still patient is having only Agni Dushti? We can use only Agni corrective Chikitsa and the patient will be cured? Because in the chronic condition, that Agni Dushti may have lead to the generation of many other causes, and one cause is Krimi. That is why I'm saying we need to think a step forward from the basic concepts, and then we need to take the history. We need to take the symptoms from the last 20 years. Then we need to club all those things. Then we need to see what we are thinking is right or wrong. And if it is matching, then surely with this Krimi Chikitsa, we will get the results. For example, all the urticaria cases, test this Krimi Chikitsa for, let us say, like 45 days, you'll start getting the result.
Vikramji asks here, as you mentioned rightly about the promotion which promote growth of Krimi in the bodies, like you have mentioned causes of growth of Krimi in the body. Before that, Krimi should be present to grow. It should be present in the body. Does Ayurveda explain the entry, like a portal of entry of Krimis into the system?
Yes, there are two things: whether Krimis are already present in the body or not, or whether they are getting an entry from outside world. Microorganisms are always present in our body. Our gut contains 3 trillion types of microorganisms. Even our full body is not having such a number of cells, right? So the question is, our body, our mouth is exposed, our openings are exposed to the environment, and our intestine is generally exposed to the environment totally. It's a channel from the mouth to the anus. Anything is going, like air is going this, everything can go in this and come out from this. It's an open channel. So we already having all types of organisms in our body. Point is that our body, if our immune system is good, if our immune system is not allowing that organism to grow, then these organisms, these Krimis, will not produce disease. And generally what we see is every other person is having worms, but do every other person having some kind of allergic or autoimmune diseases? No, because when a person is having a good immune system, the body's immune system is not allowing that. Or one more thing is that, even let's say, suppose we are having I'm giving a general example. Suppose we are having microorganisms in a number of 100. We are having 100 microorganisms, one type of microorganism 100, and that body is stopping them to grow, and that they are not producing any pathology. But if that 100 becomes 100 millions or 100,000, then there is a possibility, then the symptoms will come. This is one thing. Another thing, worms or microorganism can come from outside also. Our bodies have many openings and they can come, not a problem. Even they can come from the cut surface of skin.
So that's where Bahya, Abhyantara, Krimis, everything has been explained in Ayurveda text that you say. Yes. And Vidanga also in our Shastra has been used as a rasayana also, sir, in many contexts.
Yes, that is why Vidanga is working as a very good rasayana.
Very good rasayana. Thank you, sir. Dr. Padmavati ji has a question here. What about craving for milk cream? Is that also due to worm infestations?
It can be. That is why I'm not listed any food. I'm saying craving for any food. I have seen patients craving for cold drinks. One person saying me, I was taking cold drink with every meal. I was not taking water at all for years, for 3 to 4 years. After that, I got urticaria. One person, like I gave the example of that, she was taking the uncooked rice. Another thing, some person is taking, that habit is called as pika. Another person, like you will take the history from the kids, you will find very, very amazing amazing symptom. है ना? A person, the mother will say, my kid is like 10 years old and is not eating any like any solid food. He like behind the milk. He demands milk like 3 to 4 times a day, and he's not liking any solid food like chapati or like bread or something like that. You'll find many such. So craving for milk cream can be a symptom of this.
When we are speaking about cravings, sir, here,
Yes.
craving can also be a symptom of Ati Agni or Tikshna Agni.
Yes.
How do we differentiate this clinically?
There is a little bit difference of that. Like that craving you will find is for some little period, and that craving you will find a person is having craving for a particular kind of thing, like a particular kind of food. Let us say here we will find one food which is called a rajma. The person is that kid is having a craving for rajma, is saying that this food should be given to me every other day. For 6 months it is okay, and for after 6 months he will develop hatred for that food. So this kind of variations you will see. So for that kind, or and in that Ati Agni or that Bhasmak Rog, the patient will not crave for anything in particular. He will crave for anything to eat. Anything to eat. He'll say, keep on going something to eat to me again and again, whatever it may be.
A related question also from Pradnyaji here. Do people get disease when they have cravings for abnormal food or any food like sweets? She gives an example. A 6-year-old girl had craving for sweets,
Yes.
and ate lots of sweets, meat, and later developed triglycerides issue. Is this a case of Krimi? How would you consider it?
It can be, but we need to. This is only one symptom. What I said is this. That is why I am listing so many symptoms. Yeah. So that girl is 6 years old. Start taking history from the first year of her life. Ask her mother, was she having any problem in the first year of life? Okay. What was she having in the second year of life? What was her appetite during the first 2 to 3 years? What type of food you see? I got another case of that 12 years kid which was having psoriasis in the last few days. Like when I took the history, they said we both parents were working, and our great grandparents were taking care of the kid. And in the first 3 years, they kept on giving the artificial food Cerelac 3 times a day to that kid. So that was one factor which helped the formation of Krimi and later on autoimmunity.
So in this condition, what Pradnaji mentioned, we can consider Krimi Chikitsa
Yes.
as an added part.
Yes, we can, we should. It will increase the cure rate.
One more question from Padmavati ji is mostly bedwetting plus grinding of teeth. You mentioned that, sir.
Yes.
Will be definitely due to worm infestation. What's your opinion on this?
Yes, I have a great experience. I have a good experience in that. Every case of bedwetting, it can be cured with the Krimi Chikitsa. I have examples of 12 years old, 16 years old boy. Bedwetting can be. I'm again saying. Why I'm saying this, because I have been doing this kind of practice in last at least 15 years.
Bedwetting, when it comes, sir, how would you handle infants?
See, infants is not a bedwetting. Infants means the kid. I suppose. What do you take infants? Means 6 months kid or 1 year kid?
Or a grown-up kid also we can consider.
No, so this is bedwetting in general. In let us say, I suppose I consider in up to 1.5 year, that is not bedwetting. That is like the kid is still learning to his urination process. We consider bedwetting after the age of 2 years, 3 years, when he or she cannot control. That is why I'm giving examples of 12 years old and 16-year-old. Because though when a person is 16 years old, he or she is well aware of, but she still cannot control.
We will consider the age group of Kshira, Annada, and Annada stages.
Yes.
So those stages are more prone for Krimi.
Yes.
What is the proportion of cases you handle in adults, sir, like Krimi Chikitsa?
I am getting all ages. I am getting patients of all ages having such symptoms. Even I am giving examples. You're 50 years old, 40 years old person, 25 years old person, and getting wide variety. Almost in every age, I am getting such cases.
Thanks, sir. Can presence of Krimi be detected from Nadi Pariksha? Any take on this, sir? Nagesh ji has this question.
Truly speaking, I don't have any experience of diagnosing the Krimi from the Nadi. Yes, one may diagnose this, but that needs a profound experience. Let us say, if you will ask 15 years after from now, I may be able to answer this question, but still not now.
Like Vikramji also has a question. You mentioned particularly judicious, that word with Krimi kuthara
Yes,
rasa.
yes.
What was the reason for using that judicious? Was it with respect to dosage, season? What was that?
Yes, yes. The reason for using this word is because when we introduce some medications or some herbs to the people, they start taking those things by their own without consulting their Ayurveda physicians. So if a thing like say judicious means you are taking milk, you are fond of milk, for example, and you think that milk is good, and let us say your age is like 40 years, you are taking milk like 250 ml of milk morning, afternoon, evening, and at night, 4 times. Do you think it is good for you? Do you think it is going to boost up your tissues in a healthy way? No. So that is not a judicious use, right? So somebody is very fond of some food. Like my friend is very fond of burger, and he is taking burger every day. What will happen after 3 months? He is going to develop some problem. That is not a judicious use. Similarly, in the medicines, so this Krimi kuthara, it has to be used in that particular dose, in that particular duration, and under the guidance of physician. That was the only concern.
Are there any contraindications also? Vikramji wants to know that.
Yes, every medication has a problem if it is not used in the required dose. Even the paracetamol has to be taken. It is 500 milligram or 650 milligram. You just take 2 gram, take 4 tablets of like crocin or paracetamol, you're going to have problems. So this is the only contraindication. There is no any other contraindication. Only you need to think is if the if that particular medication is having some ingredients which are like pith aggravating, so you need to know the kind of person is there in front. And I expect that every Ayurveda physician which is treating his patients, first of all get to know the prakriti of the person that is in front of him.
Thank you there, sir. Can you also throw some light in the differences between Asava and Arishta Vidanga form? Vidanga, Asava, Arishta?
Yes. Asam and Arist form are like the difference is only in the form of the process of formation. So Arist is like formed with the help of fire. We need to make some quath, or we need to give some more like heat to that. In that case, and asav is made in a different process. We put all the things together in a vessel and give time, and it is formed over a period of time without much involvement of the fire. That is the only difference.
Thank you there. And any specific areas where you would prefer Asava or Arishta to be used?
Yes, in general, I use both of the things as per the availability. But I have seen the arrest, sometimes they are like irritant to those persons which are having APD symptoms, acid peptic disease symptoms, which are having little acidity, which are having like burning chest or something like that. Arrest may cause some irritation to such persons, or arrest may cause some disturbance or discomfort to those persons which are of pitta prakriti, pitta predominant nature. The persons who are with pitta predominant nature, even I have seen pitta predominant persons taking arishta in a good way without any problem, but that is a case specific.
Okay, thanks, sir. Krimi is a form of ama. Can it be number one? And if yes, can Chitraka be used, or does it have any role? Vikramji asks, Krimi, can it be a form of ama, or ama is a positive factor for Krimi? How it would be?
I don't consider Krimi is a form of ARM. I consider ARM is the unmetabolized products of digestion and metabolism. And when they are there in excessive amount, they allow the production of Krimi. They like they form like a breeding area for the Krimi or the organisms which are already present. Sometimes we are having the premature stages of the Krimi, like larva. We are having larva, or we are having cyst in our body. Somebody is having a cyst of a parasite in the chest, in the lungs, and it is not causing any problem. But when there is an ama collected in the chest, it will allow that cyst to grow into a microorganism, and that microorganism will produce many chemicals which will be roaming around in the tissues, and they will generate a reaction from the body, and they will produce symptoms.
The other way is possible, sir, like there are krimis in the system and they can generate ama.
Some conditions, yes, in some conditions, sure, they can, as I told, that amadosh, dushivish, krimi, they are like integrated. Each one can produce other can produce other.
And Dr. Savitri ji also wants to know if we can give krimi kuthara rasa in state of pregnancy. If yes, how long it can be given?
I think we have better options from Krimi Kutharas in pregnancy, like Krimi Dhatani Churan. That is the most, like, we need to select those medicines with which we should be firm that it may not cause any problem in any way. So that is like a Krimi Dhatani Churan. We can give that in pregnancy in a smaller quantity.
Like speaking about this, sir, so what could be the most preferable method, like prescribing the krimi medicines, anti-krimi medicines, like give medicines which expel or kill the krimi and then give a virechana or something to expel that, or use a combination of both?
Yes, we should use a combination of both. Okay, because what I use is, like, I am using Krimi Kutharas 2 tablets twice a day, and I am giving Mridu Kost Shuddhi every week. I am giving a medicine every Saturday to the person, so that every Sunday that person must be getting a good evacuation, like in 2 or 3 times. So this goes on for like at least for 12 weeks, and it is a gentle process, and it is not causing any weakness in the body. So my patients are taking these in a very good way, and I'm getting the results.
Do you mean to tell that it might take around 12 weeks for the krimis to totally be
Yes.
destroyed from the system?
Even
Or you want a more sustained effect and result?
yes, 12 weeks is the minimum period. 12 weeks is the minimum period. If some patient may require more time, that depends upon the case to case.
The later weeks, like maybe if we divide 12 weeks into 6 and 6, the last 6 or 4 weeks you are looking at apunarbhava?
That depends upon case. It is not a similar thing in every case. In some cases, continuously I am giving Krimi Chikitsa for 12 weeks. After that, I am using some rasayan for the apunarbhava chikitsa.
Thank you, sir.
Depending upon the progress of the case.
And once again, there is a question from Vikram ji. Again, Nadi, as you already conveyed, sir, can it be diagnosed through Jihva or any other diagnostic tool?
Yes, that is also a like a case of experience. You know? Somebody is making many diagnoses from observation of the tongue. Somebody is not very well versed with the examination of the tongue. So that depends upon the experience.
During pregnancy, sir,
Yes.
many women develop different types of cravings. I think you mentioned that somewhere.
Yes.
Can we consider this as pregnancy related to or due to worm manifestation or krimi, the different types of cravings in different women? Dr. Padmavati ji's question.
So see, if a lady is pregnant and she has developed craving for some things, this is a fact that pregnancy causes craving for many. Another thing, are we having symptoms of allergy or autoimmune diseases like I have listed in that lady? Is that lady is having such diseases before the pregnancy also? So all these things need to be clubbed, and then we need to decide if that symptom of craving is due to the pregnancy or due to the craving. So we need to take elaborate history. That is why I'm emphasizing history taking is more important. History taking is well important. It will give us many clues.
Any good krimis are there in our body, like good bacteria in our gut? Dr. Abdul Karim sir's question.
All the krimis, till they are not producing any harm, are good. It's a like very what we say is that it's a very diplomatic answer, but it is true. We are having krimi. Krimi are like symbiotically living in our body. They are helping. Why the system is made by God like that? We are having krimi because these krimis are helping us. Actually, these krimis are producing many vitamins in the gut.
Has Ayurveda mentioned that point somewhere? So is
Yes, it has been mentioned. Yes, I'm not giving the reference, but if you say, I'll provide the reference in the group that there is reference of like those krimis which are not producing disease. These are called Sahaj krimis. This is a reference from Vimanasthan.
Thank you, sir. Thank you, sir. We would love to have the reference of that.
Yes.
And Vinaya Saunders ji, she has a question like, if we take dosage of Vidanga, maybe a proper dosage of Vidanga, is a long-standing Krimi gone? Like, is it almost a permanent cure?
Almost.
Vidanga,
Is
Vidanga.
yes. It is almost 99% permanent cure. See,
Mhm.
we cannot claim anything which is permanent in the medical field. Everything is like related. Everything is like context specific. For example, you have cured a case, you have eradicated all the causes, you have tell the patient, you have told the patient that you need not to use this and this will cause problem, and everything is going good. But at a later stage, if that person again is indulging in those causes which are helpful in the generation of Krimi, what will happen? So that is the thing.
So will Amapachana herbs also reduce Krimi? Vinaya Saunders ji's question.
Yes, in the early stages, like we are getting a case in which we are getting very few symptoms, and we are just doubtful that whether the Krimi is present in that or not. Then we need to employ Ampachan Chikitsa first for few weeks, and we'll see. We need to see if that helps. So this is like a therapeutic test. We are giving Ampachak Chikitsa in the early stages, like 4 to 6 weeks, and we are seeing what is the improvement in the symptoms. If there is an important improvement in the symptoms, that we need to consider that this Ampachak Chikitsa is helping to stop the growth of Krimi. That is the thing.
Thank you there. And one more question, sir. How can we deworm 3 years kid
Three
at a
years
time?
kids, we need to find some medicine in the form of syrup. Many pharmaceutical companies now are coming up with the syrups. Like one in India, there is one company that is Badri Pharma is forming a syrup, anti-worm syrup. We can use that, or we can use that Krimi Dhatani powder in a small amounts with mixed with the honey, or Krimi Mudgarras. Krimi Mudgarras is a tablet. We can crush the tablets and we can add some honey and we can mix that and we can give the child by licking.
Okay, sir. Thank you there for your uh, patience answering all the questions with the utmost patience, with a smile on the face, and very good answers. So, one question to end up the session.
Yes, yes.
As Pawan sir ventured into formulating his own medicine for Krimi, because you have extensively worked on Krimi, have you ever thought of or have you ever done something in that perspective?
Sir, I am making few medicines for my use, for my practical use, like mixing some herb, simple medicine. But I have not thought of like going for a detail like marketing of that medicine or something like that. I'm using it for my patients, like making some like this Vidangadi Churan. And Vidangadi Churan, this is not available with any pharmaceutical company. I'm making this at my clinic and using with my patients, and it is giving good results.
Thank you there. Thank you so much, Pawan sir, for your extensive research on the Krimi, the concept of Krimi. Rarely talked about topic, as I said, even in medical classes also, it is a chapter which is rushed through, and there may be one or two questions like mention the types of Krimi and that, this and other things. Students know about the Chikitsa Sutra of the Krimi Chikitsa, and not much more than that. There are very few people like you who have gone extensively deep into the concept. I think that this was a thought opener. On behalf of Easy Ayurveda and all our participants and Easy Ayurveda family, a hearty thanks, a big thanks to Pawan sir on behalf of all of us.